Are you all aware of that high protein meal can cause kidney damage? How? What do you mean by high protein meal? Basically, people eat very high amounts of meat, especially the red meat, which contains a lot of muscle proteins. So these muscle proteins get into the blood circulation and get filtered through the kidney, and also increase the blood circulation to the kidney, which can cause protein leakage and kidney damage. Okay, so who are at high risk to develop this kind of problems? I will mention that people who do a lot of heavy exercises for bodybuilding competitions, and also wrestlers who want to maintain body size for the sport. So probably these are the people who would like to eat a lot of meat-based proteins, biological protein, as well as sometimes they take commercial protein, which is now available in the market easily. One can go and buy on the counter and take the tins and then keep eating to build the muscles faster, and then so that they show their efficiency, and then probably they win the competitions. But how does these high protein products will cause kidney damage? So when you eat high protein meal, it will increase the blood flow to the kidney. So when the blood flow to the kidney increases, so these blood will flow through the kidney units, what we call as glomeruli, filtering units, and then when they increase the pressure of the kidney, and then which will result in protein leakage. That is the first step. And if you don't stop doing this, keep on eating the high protein diets, and then it will cause kidney tissue damage and also later on kidney dysfunction. So this is what the kidney filtering unit, what we call it is glomeruli. And then when you eat high protein meal, so it will increase the blood circulation, blood volume, and then that increased blood will filter more. Filtration will happen through these kidney units, and then these are the kidney units are very delicate units, and then it will cause kind of damage to the walls of the blood vessels and causes leakage of the proteins. So once you have leakage of protein, this protein itself leakage can cause kidney damage further and also kidney dysfunction. So my suggestion is people are doing exercises for various purpose of their bodybuilding competitions, wrestling competitions. So they can eat protein. So, but make sure that you are not eating too much of protein to get the benefit, get the something like you get the shape of your body going for competition, winning competition. But you can do that. Probably you should take precautions not to eat too much protein, and then which might result in kidney damage. One way is basically to see that to balance how much protein you are eating per day. Normal recommendation is about 1.5 grams per kilogram, which will be like 60 to 70 grams per day. But somebody is eating 120 grams, 130 grams. Those are the people in long run. It doesn't happen in 1 month, 2 months, but if they're eating for many months, like 1 year, 2 years, like that. So though they get benefit of kind of having a good muscle mass for their purpose, but indirectly it can result in kidney damage. I have seen few of these kind of people coming to me showing the report of kidney function test called creatinine, which is on the higher side. So I look at the way people and see that they are bodybuilders. Then I'll ask them, what are you doing these days? They say that I'm doing a lot of exercise for the bodybuilding. So I will tell that probably this is because of too much of eating this protein. Your kidney function test is on the higher side. Probably I'll suggest that stop it for a while and then repeat the test and see that what happens. I have seen people after stopping eating too much of protein, and then probably I've seen that the kidney function test got better. So it can be easily preventable damage, but I don't say that don't eat too much of protein, but balance it in such a way that, and keep checking your kidney function test maybe once in 6 months or 1 year, and see that your kidney function test is within normal limits. So nothing wrong to take protein, but anything is too much is not good for health. Either it is protein, fat or carbohydrate, all these foods too much eating is not good for the general health, as well as sometimes the kidney damage takes place because of the high meal protein. So this is what my general recommendation is. See that what is the protein recommendations per day allowed, and then see that little more than probably recommended is fine, but too much higher than the recommended protein intake might result in kidney damage in long run. Long run in the sense that in years, not in days and months, but it may take a year or 2 years, even longer. So, suggestion is balance it. Balance your diet and balance your purpose. Suppose if you are going for a competition, see that how much you can eat. Take advice from the physicians, doctors, and see that this much protein I mean easy to get doctor to take, so that you get a suggestion, so you can avoid damage to the kidneys. Once damage is taking place, sometimes it cannot reverse. So then you will suffer, and then the kidney disease can progress over a period of years and then cause more and more damage. So avoiding high protein meal, you can protect the kidneys from getting damaged and developing kidney dysfunction.